Hi, my name is Shasta. I'm a nursing student at OSU. I'm going to be helping taking care of you today. I'm going to wash my hands first. Check your name. Can you tell me your name and your date of birth? Okay. What we're going to do is a head-to-toe assessment. And we're going to start by your scalp, inspecting your scalp, making sure that there's no bumps, lesions, or depression. Checking for symmetry between your facial features. Your ears are aligned, your eyes are aligned on both sides. There's no prettiness on your nose, and that your nose is centrally aligned. I'm going to palpate your sinuses. We're going to palpate your maxillary. I want you to tell me if there's any pain or tenderness. We'll palpate your frontal. We're going to test your cranial nerve 5, which is your trigeminal nerve. We're going to have you open and close your jaw. We're checking for any popping or locking in your mandible. And then I'm going to have you close your eyes, and I'll let you know whenever you feel something on your face just by saying now, okay? Close your eyes. Okay. Now we're going to test cranial nerve number 7, which is your facial nerve. I'm going to have you puff out your cheeks. Okay, and smile for me. We're checking for symmetry, making sure there's no signs of drooping or evidence of a former stroke or anything like that. We're going to check your eyes, make sure that they are aligned and the same shape. We're going to inspect your conjunctiva as you look up, and for making sure it's pink and moist. You look down, make sure your sclera is white and moist. We'll make sure there's no external drainage or excessive dryness with your eyes. We're going to check for perla, making sure that your pupils are equal, reactive and responsive to light, and that they accommodate. I'm going to shine the light in your eyes. Make sure that the pupils are constricting at the same time and equally. We're also checking what your pupil size was, which is at a 3, which is normal. Have you look at my pen. Follow it out, and making sure that your eyes are accommodating, your pupils are accommodating as the pen goes in and out. Next, we're going to check your nose, checking externally for any excessive dryness or drainage. I want to have you flare your nostrils, making sure that they flare symmetrically, and I'm going to test for patency. I'm going to have you block off one nostril and sniff for me, and then do the other side, making sure that it's clear and that it doesn't sound like there's any blockage. We're going to check internally, making sure your mucous membrane is pink and moist, and that there's no structure that are blocking off your nostrils or signs of a deviated septum. We're going to go to your mouth, making sure that there's no external lesions, excessive dryness, or and that they're symmetrical. Have you open your mouth and check your mucous membrane, make sure it's pink and moist. Your tongue is also pink and moist, and that your gums, there's no signs of bleeding or gingivitis. Your teeth are straight and aligned. There's no signs of decay or malnutrition. Next, we're going to move on to your ears and check externally for any bumps or lesions or drainage. We'll palpate your ears for any pain or tenderness. We'll do this on both sides. We're going to test cranial nerve number 8, which is your hearing acuity. I'm going to have you cover up one ear, and I'm going to whisper in one, and then we'll go back. Okay. Next, we're going to move on to your neck. I'm going to check your trachea, make sure that it's centrally aligned, that there's no visible signs of pulsations with your jugular, or that there's no jugular distension and that there's no visible signs of a brewery. We're going to auscultate for a brewery. Making sure there's not a whooshing sound. That would be a sign of a brewery, which is a narrowing of the veins. We're going to, we'll check your carotid pulse on both sides, but not at the same time because we don't want you to pass out. We're going to test cranial nerve number 11. I'm going to have you push your chin against my hand and on the other side. And then I'm going to have you also shrug your shoulders, making sure that you have strength and that your accessory nerve is symmetrical and there's no signs of abnormalities. Next, we're going to move on to your posterior thorax. We're going to visually inspect your chest, making sure that there's no making sure that it looks dry and there's no excessive moisture. We're watching your accessory muscles, making sure that your chest is rising and falling equally. There's no sound, audible sounds of wheezing or rhonchi. We're going to palpate your skin, making sure that there's no, that I can't feel any external pulsations and that it's cool, and no signs of temperature or excessive dryness or excessive moisture. Next, we're going to auscultate your lung sounds. We're going to go laterally side to side and then top to bottom. And we're listening for rhonchi or wheezing, making sure that there's no fluid in the lungs or that your lungs don't sound deflated. We're also going to listen to your heart, which is going to be within the second and fifth intercostal space. When we palpate your skin, we're looking for any signs of visible pulsations and feeling if I'm feeling any type of pulsations that shouldn't be where I would expect them. We're going to listen to your apical pulse positions, which is on your left, your right second intercostal space, your pulmonary, which is on your left second intercostal space, your Erb's point, which is in the right third intercostal space, the tricuspid, which is in the right fourth intercostal space, and your mitral, which is in your fifth right side intercostal space, mid-clavicular, I can't say the word now, clavicular. We're also going to listen to your apical pulse, which is in your fifth intercostal space, mid-clavicular. I really can't say the word right now. And we're listening for any type of murmurs or making sure your S1 and S2 are paired loved up. I'm going to have you lay back. We're going to inspect the contour of the abdomen, making sure that it's round. There's no protrusions or wounds, lesions, anything like that. We're going to auscultate your abdomen. We're going to start by the right upper quadrant, the left upper quadrant, the left lower quadrant, and the right lower quadrant. We're listening for active vowel sounds where we don't want hyperactive or hypoactive. We're going to palpate your abdomen. We're ensuring that there's no pain or tenderness. So if you feel anything, just let me know. We're going to do the right upper, left lower, and right lower. ensuring there's no tenderness, and also feeling your skin, making sure that if it's cold, there's no signs of a temperature, there's no excessive dryness or excessive moisture. Step back up. I'm going to go to your, do you do a monthly breast exam? No? Okay, so you want to pick a same day every month to do the monthly breast exam. The benefits of doing that is so if something abnormal comes up, you start having a bump or tenderness or drainage, you can report that to your doctor. So how you would do that is either in the shower or laying down. You can put your arm behind your head, and you would start from your armpit and in a circular clockwise motion, you'll go down towards your nipples and feel for any types of bumps that are on a normal basis, and you're going to know your body better than anybody else. You're going to go down towards your nipple, and when you get to your nipple, you're going to pinch, and if there's any drainage, you would report that to your doctor. And you would do that on both sides. Now we're going to go to your posterior side of your thorax, which is your back. We're checking your spine, making sure that it is centrally aligned. There's no curvature or hunches or anything like that. We're going to, I'm listening for any sounds of bronchi or wheezing. We're going to palpate your respiratory in the back. I'm going to have you say 99 for me. Again. Okay. I'm checking symmetry on both sides, making sure that I can feel the reverberation on both sides and that there's no signs of diminished or fluids in the lung. I'm also going to have you take a breath. We're checking to make sure that your lungs are expanding and deflating equally, and that there's no signs of a collapsed lung. We're going to auscultate your lung sounds. We're going to side to side. Once again, I'm really listening for any type of wheezing or bronchi. And we listen posteriorly and laterally on both sides, as we want to make sure that it's equal.